One of the commonly expressed fears with dentistry during COVID is the fear of dental aerosol. So what exactly is dental aerosol? My daughter Sia is agreed to be the patient for today, so I'm just doing this to explain it without actual personal protection equipment as such, just to explain what exactly an aerosol is. So when dentists use a drill to drill into your tooth or drill around the tooth, they use something called aerotor. These are devices which are driven by air, and then when a dentist presses the pedal and the drill starts rotating, this is what happens. So you get this air which is mixed with water and it hits the patient's mouth like that. Okay? So when the drill along with the air and water hits the patient's mouth, the water mixes with the saliva in the patient's mouth and then comes out in the environment into something known as dental aerosol. So this can be infective. If the patient has some sort of infection, then it can be transmitted through this dental aerosol. So what are we doing here in our clinic to minimize this dental aerosol? There are 3 steps we use to minimize dental aerosol. The first step is to use something called rubber dam. So a rubber dam is a sheet like this, which has a hole in the middle through which we can isolate the tooth. So what we are doing is we are separating the rest of the mouth from the tooth that we're working on. So let me just show you how it works on Sia here. Now once we do this, you can see only the tooth is visible and the rest of the mouth is completely protected from aerosol. So now when we actually start working on this tooth, what happens is the aerosol hits the tooth, and that's it. So it's just a question of the air mixed with water, but there is no contact with the patient's saliva at all. So what happens once you isolate a tooth with the rubber dam, you can work freely without any chances of the air getting mixed with the patient's saliva. So that's the benefit of the rubber dam. So that's the first tool we use. The second tool we use is, I mentioned that these handpieces are driven by air, but in our clinic we're using something called electric motors. So instead of air, we have motors which are driven by electric power rather than the air power. So you minimize the chances of aerosols because there's not much of air coming in through these handpieces. So that's the second technique. The third technique is by using high wax suctions. You must have noticed my assistant Om Prakash using high wax suctions. So we have 3 high wax suctions attached to this unit here, and once we have these suctions working in tandem, they also remove excess aerosol coming out. So as you can see, once you combine these 3 together, that's the rubber dam, the electric motor handpiece, as well as high-powered suction, it completely eliminates aerosol in our operatory. And to add to that, we have high-powered air purifiers installed as an additional resource to remove any existing aerosol. So we can completely eliminate aerosol in any procedure that we do in this clinic.